Hi guys, welcome to the channel. In this video, Russ Scala, expert in performance and TRT, in medicine over 40 years and writer of the American Biohacker, he will talk about thyroid and depression. Welcome, Russ.
Please like and subscribe. Thank you.
Hey, Stephen, how are you guys? Hey, how's everybody? I hope I can shine some light on some areas that aren't talked about yet, so be patient with me.
Okay, Russ, before you talk about thyroid and depression, maybe talk a little bit about your history being a paramedic attached to a SWAT in 1984.
Yeah, okay. Folks, I want you to understand that, I've traveled to the best research labs and some of the most brilliant PhDs and physicians and college professors in the area of depression. I'm currently working inside an addiction center introducing TRT for the opiate battle, okay? So I want to talk about some areas that you're never going to hear that we could launch through Stephen's site here, testosterone optimization, because I want you guys to get answers. And sometimes I upset other physicians because I take them down a road that they've never been before, and instead of embracing what I'm saying and looking at it, they put walls up. And so here we go. In 1984, I was a paramedic attached to the SWAT team. I wanted to save lives, obviously. And that environment really damaged me over time, where I was in my 20s, people were dying in my arms. I was covered with brain matter on 3 or 4 occasions, and I didn't want to talk to anybody. So I would drink with my tribe. I would, after work, we would hang out, drink, and just, back at the time, I didn't think I would live to 40. And, I'm in my 60s now. So in 1984, a police officer, good friend of mine, and another good friend of mine committed suicide in a period of 6 months. In 1984 was when I started to drill down on the multiple metabolic factors of what causes depression. So what have I gleaned from that period of time? In 84, I was passionate about never ever missing somebody that was depressed that put a gun in their mouth again, okay? So since that time, I talked with the best psychologists and psychiatrists. I've run lab panels on war veterans, EMS personnel, executives, celebrities that are depressed. I collect data, and here's what we can learn, Stephen, and people out there. Everybody is biochemically unique when it comes to depression. Depression is a label, and that feeling you have is multifactorial, okay? It could be the state that you're in right now. If you're going through a divorce, if you are a police officer working undercover, okay? If you're an endurance athlete, all those things can cause depression and neurotransmitter imbalances. So we know everybody with depression is biochemically unique. We know that you're never going to take one pill. Let me give you an example. Dr. Peter Breggin wrote a book called Toxic Psychiatry that blew the lid off the pharmaceutical companies that developed antidepressants. They're billion-dollar drugs. We know over time that SSRIs, SNRIs damage the prefrontal cortex over time. When you put a kid on an antidepressant or a 20-year-old, his brain is not fully formed. The prefrontal cortex is not fully formed. So that being said, Prozac, Paxil, Zoloft, SSRIs, we had to look at other areas. These drugs also damage the mitochondria. I've got more information on that on the Russ Scala YouTube channel, and I got documentation of war veterans that I work with, and I turned around with TRT therapy, depression. So that's what I want everybody to think about. If somebody on this page cures their depression, what works for them may not work for the next person. So that's what we all have to think about, guys. And Stephen, we are all biochemically unique. And depression is a big label to catch all for everybody. So the research on thyroid is part of the HPAG axis. Low thyroid right now is being studied to elevate serotonin and dopamine levels in the brain. Now we know that's good. I rather have thyroid to help me with my depression than there's no Prozac receptor sites anywhere in the body. We know that the brain is the most metabolically active tissue. There are billions of mitochondria in the brain and maybe hundreds in the cell of a bicep muscle. So the brain and heart are metabolically active. We also want to look at the gut-brain connection. The intestinal tract is a second brain. If that flora is out of balance, that will exacerbate depression. So it's a multifactorial approach that's customized to each depressive person. The reason the psychiatric and the psychology community, why talk therapy doesn't always work is because they're treating the head, not the body. We need to look at the metabolism. Does that make sense?
Yeah, sure.
Okay. Cool.
Yeah, and about that gut biome, how do you test for that? I have no idea really.
Yeah, we test. In 1996, I went to the Great Smokies Diagnostic Lab. They were the first lab to do stool sampling in the United States. So I flew up there, met the owners, and what I gleaned from that is we could check the microbiome with urine and stool samples now. And that's going to give you a good overall picture of your microbiome. And remember, your microbiome is as different as your fingerprint. So even with this advanced testing, we don't just want to look at test results and think one thing is going to fix it. We have to treat systems. Now, I talked to the best TRT people over the last 10 years, and for some reason, they got upset with me because I'm not teaching their program. Again, I want to open source this to everybody. All right, there is no quick fix, but the thyroid plays an important role. The thyroid and adrenal glands work together. So if you have low cortisol levels and your adrenals are burned out from years of stress, it will slow the production of neurotransmitters in your brain, serotonin, dopamine, and adrenaline.
Mm-hmm. Okay, and I know a lot of men being depressed in their 40s, 50s, they have low thyroid and low testosterone. Which one of those has to be corrected first, or do you correct both at the same time?
No, that's a great question, because most of the TRT docs out there and most of the gurus, they treat testosterone in isolation. Mm-hmm. I've consulted low T centers across the United States. I've set up over 25 anti-aging centers, and my job was to train the physician not to treat testosterone in isolation. So the thyroid and testosterone and the adrenal glands are all part of treating erectile dysfunction along with increase in nitric oxide. There's a test out there called asymmetric dimethylarginine that measures nitric oxide production on the arterial level. All right. Mm-hmm. So if you're not getting an erection, if you're depressed, like I said earlier, if you can't get an erection, get your heart scanned, because that could be endothelial dysfunction. So we don't want to miss any of that. We don't want to treat somebody for depression and erectile dysfunction and then have them have a heart attack. So these are signs that we need to look at, okay? And most people I meet have been on a 4-year journey trying to find answers, and they can't because everybody is treating them with sweeping generalizations. Each program has to be customized to the patient.
Yeah, sure. And how do you treat hypothyroidism together with hypogonadism, actually? Just give testosterone and T3, T4?
Yeah, testosterone, T3, T4, maybe we use some oxytocin, some low dose sildenafil citrate. We got to have a big toolbox, mm-hmm. depending on who. And then we got to monitor it because, most of my clients and patients have my phone, and I have the doctor, the lab, and the pharmacy's phone. So I could fix dosing pretty quickly if we need it, because a lot of my clients run multi-million-dollar companies, and if they can't get off the couch, they're going to lose money. Or they're involved in a startup company, so I got to make sure they get answers quickly. They can't wait a month and go into a doctor's office. So yeah, Stephen, we want to get a baseline blood work and think about the other areas that traditional medicine isn't treating. We know this could be psychological, stressful, and it could be a problem with endothelial dysfunction.
Mm-hmm. Well, in our sick care or health care, whatever, in our medicine, general medicine, depression is a psychiatrical disease. So here in Belgium, for example, if you're depressed, it's just a GP making that diagnosis, and he will send you to a psychiatrist, and he will just treat you with SSRIs for sure. How come doctors are not trained in the hormones, actually? Why is that not right?
No, and that's why what you're doing, you're saving lives. By starting this group, you're saving lives, because there's something very powerful and transforming about asking a question. If one of your clients or one of the guys we educate here hear this, and a doctor says, I'm going to give you an SSRI, he may wait a minute. Let me run a lab work on my thyroid. And then the doctor will come back and say, hey, your lab work's normal. He says, what about subclinical hypothyroidism? Here's the research. Hey, doc, treat my symptoms. I feel like shit. Don't just write me an SSRI.
Mm-hmm. Yeah, exactly. So we're helping, teaching other doctors and patients, especially, to be more educated on the matter.
And there's something powerful and transforming about asking a question. I used to train doctors all over the United States. Now I'm going directly to the people. I get more gratification for that. Every time I meet a doctor, I got to go through an interview on why I know what I know. I'm like, read my book, whatever. I got over 130. I got 130 videos on my YouTube channel. You can't watch a video for 3 minutes before we have a meeting, so I'm done with doctors. No disrespect. A lot of my friends are doctors. I'm just done. I want to educate the guys, and here I am.
Okay, you're doing a great job, Russ. Thank you for that.
Okay, no problem. My pleasure.
Okay, so let's end this here and maybe tell the viewers how you can be reached, how they can work with you.
Hey guys, you know how you can reach me? I started the Russ Scala YouTube channel just to educate people around the world. I got a lot of topics up there you can look at, from microdosing LSD to, you know, performance enhancement to interviews with war veterans on how I turned around brain injury. So that's on the Russ Scala YouTube channel. Feel free. And then obviously Scala Precision Health is in Orlando, Florida. And if you could download my book on Kindle for $4, American Biohacker, and write a review, that's going to help us all out. Thanks, guys. Appreciate it.
Thanks, Russ.
Thank you.